everybody see the screen? Great. So I'm just going to talk a little bit about research in pediatric rheumatology. I appreciate SNAC is essentially a charity about arthritis, but a lot of the research we do and the principles of it kind of overlaps. So I'm not going to necessarily completely limit it just to arthritis. A lot of the medicines overlap in particular as well. So just want to talk a little bit about why we do research and what kind of research we do, and then about what challenges and barriers we face perhaps sometimes to research, and some of these are quite generic and some could be quite specific to our current situations in Scotland and elsewhere. Going to mention a little bit about how young people and families can get involved, because it's really important that that happens. If we're going to do good, useful research, we have to make sure that young people and families are at the heart of that, and talk a little bit about what's going on in Scotland in terms of paediatric rheumatology research, and then about what's going on in the UK, because patients from Scotland are not limited to only accessing research from Scotland. They also have the ability to access research in the UK and take part in that. And then hopefully the main part will just be a chat really, where I find out what you guys are most interested about in terms of research in rheumatology, and then we can just have a chat about that and see where we go from there. So in terms of the importance of research, everything we do in medicine, but particularly in rheumatology, which is a very new field really, is based on research. It wasn't very long ago that we had almost no treatments for young people with arthritis other than aspirin or aspirin-like drugs, and most of what we did was supportive care rather than treatment in terms of trying to switch off arthritis. So that was probably just around 30 years ago that we were in that kind of situation. And then because of research, because of all kinds of research, drug trials, basic science, our understanding of how inflammation and the immune system works allowed us to kind of translate that research into treatment for patients, and has really transformed the way young people with arthritis and other pediatric rheumatology conditions live their lives and are able to kind of maximize their potential. And in many cases we can very effectively, in most cases we can very effectively treat the conditions that we're seeing. And none of that would be possible without research. As well as kind of developing new medicines and things, it's really important to have research around other issues, understanding the impact of the conditions that young people have, understanding quality of life, thinking about long-term outcomes. So it's not just all about doing research to try and find fancy new medicines as well, but we're trying to improve every aspect of care and also help predict and make accurate or helpful, useful prognosis for the future as well. And then thinking about what kind of research we do, broadly speaking, we divide research up into basic science research, and that might well be research that's based in the laboratory, finding out what's happening in the joints, what's happening at a cellular level, what your body's doing, why the inflammation is there. And by doing that, by understanding more about that, we can then translate that into clinical research where we try and have an impact on what's happening in the body as well. So basic science and clinical research are two of the main kinds of research that we do. And, the one couldn't really exist without the other. We also have clinical trials where we test medicines, we test or other interventions. And the classic one that people think about would be, where you compare a particular drug, a new drug, or a drug that hasn't been used for that particular purpose, and you compare it with a patient receiving placebo, which usually both researchers and the patients don't know which is which, so that we're blind to the outcomes, and that means that there's there's very little bias, and we can find out which of those treatments is better. We also have registries, and registries have been really important over the years in pediatric rheumatology. Lots of different kinds of registries. So we have registers of people who are on certain kinds of drugs to make sure that even years after the clinical trials, because clinical trials usually take a couple of years, and patients might be taking the medicines for 2 years or
Very well. I'm so proud of you there. Really am.
But it's really important to know what happens 4, 5, 10, 15 years down the line. So a standard clinical trial can't answer those kind of questions. So it's really important to have longer term registries so we can ensure that we're not missing out what could be potential long-term benefits or harms of any particular medicine or intervention. Really, really important for gathering long-term safety data. We have other kind of research where we think of as more as qualitative research, so research that focuses on quality of life and functional impact of either treatments or conditions, where we aim to find out how that affects patients, young people and family in terms of their day-to-day life and function. And that's really, really important kind of research, but obviously very different from either the basic science in the lab or a straightforward clinical trial where you're testing one drug against a placebo or against another drug. Obviously, although we are all so committed to research and the importance of research, there are some challenges and barriers. And for us, I think, in my experience, the biggest challenge is time. There's so much interesting and useful research you can do, but all of us are fitting that into busy clinical jobs as well. And so it's really important not to try and take on too many different research projects and then not be able to do any of them well. So certainly in Scotland, that's something that we usually think of as a team, probably across more than one site and centre. We often discuss that within the kind of various different centres as to whether people have the availability of time and support in order to make the research happen and happen well, because you don't want to start a research project and then not be able to carry it through and get useful information from it. You don't want to waste the time or the money by doing that, either for professionals or for patients and families. Funding is also obviously a really important challenge and barrier. The more funding you have, the more support you can have. And in most centres in Scotland, we're fortunate enough to have what are called clinical research facilities, where trials can happen. And these clinical research facilities have highly skilled research nurses who do a lot of the work in the background in terms of preparing the trials and supporting the trials and making sure they can happen. It's really hard to run a trial without that kind of support. So I work really closely with the clinical research facility in Glasgow, and without the various nurses and admin support there, it would be really impossible to do a lot of the trials that I'm involved with. And that all takes funding. So trials need to come along with funding if they're going to happen usefully. And then other challenges are designing the studies appropriately. It's really important, for example, to get patient and family involvement. You don't want to waste time and money by creating a trial that patients don't want to be part of. There's no use sinking a lot of funding into a trial that then you can't recruit, because it's not actually answering the question that either patients or families want to know. So it's really important to work in partnership between nurses, doctors, patients, families, pharmacists, drug companies. So it's all about cooperation and making sure you design the trial as well as possible with as much useful input at the beginning before you get started. Which brings me to how young people and families can get involved in it. I think we're a lot better at this than we used to be. So I think it's fair to say that decades ago, trials were really dominated by or designed purely by doctors and scientists, and had much less input from young people and families. Fortunately, there's a lot of structure now to try and prevent that from happening and support young people and families get involved right at the design stage and before the design stage of trials. So I've been working recently with strategy setting for research in paediatric rheumatology in the UK over the next 5 years, and we've had a number of young people and families who've also been involved in that process, and I think that's really, really important. And every trial that's being designed at the moment that I'm aware of in the UK has young people and families as part of that design to make sure that we're answering the questions that people want to be answered, but also doing it in a way that's going to be acceptable for families. And it's really interesting. Some of the things that come out of that are not always what you might expect them to be. So, for example, I'm involved in a trial on Kawasaki disease, which is something that mostly happens to children under 5, and it's just coming out. And when the trial was being designed, one of the things that we thought is that people wouldn't want very many blood tests in that kind of age group, and we would really try and minimize any kind of blood tests at all. But actually, when the trial designers were speaking to families and patients who'd had Kawasaki disease in the past, they were very keen to learn as much as they could about the inflammatory process, and they were actually happy for some blood tests to be done, so long as they knew that it was for useful purposes and going to help us understand and learn more about the inflammation and perhaps switch it off quicker. So it's really important that we don't make assumptions without asking young people and their families about that. So one way to get involved is there's an organization called Your Room, and I think it's something that I'm really trying to promote and trying to raise awareness about. And that's an organization where if I was, for example, running a trial or designing a trial and I wanted to gain input from young patients and families, rather than me just trying to ask some patients in clinic, this is a whole formal way of doing it where young patients between 11 and 24 can formally take part right at the design stage of trials. So if you're organizing a trial, you speak to Your Room and they put out a call for their members and interested young people with inflammatory conditions to get together. At the moment, that's all happening by Zoom or Teams, but previously that people have come together in a particular city or and had spent some time together discussing the issues and challenges. So I'd really like to just use this as an opportunity to plug Your Room. It's a really useful thing for us as researchers, and I think it's a really good opportunity for young patients to get involved in designing research for the future. And you can just Google your room. I think it's Your Room, www.yourroom.org, or something very similar to that to get involved. Then thinking about what's going on at the moment and what's been going on recently in Scotland, we've got quite a number of drug trials that have happened. We've recently completed a trial of a drug called secukinumab, which will hopefully be very useful for young patients, particularly with psoriatic arthritis. We're in the process of setting up a drug trial of an oral medicine, so a medicine you can take in tablet form to treat systemic arthritis, which at the moment most patients need IV infusions for their main drugs. We've recently been part of drug trials in terms of arthritis and uveitis and the treatments for that, in vasculitis. I'm part of setting up a trial in JDM for, again, another oral medicine, because one of the big barriers that young people find in terms of taking medicines in pediatric rheumatology, as I'm sure most people on this call will be aware, is that a lot of the medicines are given either as injections or infusions, and young patients don't always find that easy to do. We're also involved in trials with Kawasaki disease, which will be more as an inpatient when patients are more unwell in hospital. And recently, in terms of the COVID pandemic and PIMS, we've been, most centres in Scotland are part of a big trial that you might have seen in the news called the Recovery Trial, which has been really kind of groundbreaking worldwide in terms of treatments for COVID in adults, but it also has an arm which is involved in young patients with hyperinflammation after COVID, and so patients with that in Scotland have the opportunity to join that trial as well, in terms of trying to learn what the best treatment for that is, and rheumatology is very heavily involved in that. Also thinking about COVID and the pandemic, we've been part of a really useful trial called ImmunoCovid for patients with pre-existing conditions, not just rheumatological, but also gastroenterology and other conditions where your immune system could seem to, in theory, be lower. And we're at the beginning of the COVID pandemic, we were quite worried that a lot of our patients might be vulnerable. We've gained really useful information about that through this trial, which is actually based out of Southampton, but Scotland did very well in terms of recruiting for it. And they've now had 1,100 young people in the UK with rheumatological and other conditions, and following them to see whether our patients really were more vulnerable to COVID. And I think the answer is very clear that the patients with rheumatological conditions and our kinds of medicines have not so far been more vulnerable to COVID. So that's been very, very reassuring and very useful. There's a similar European-wide trial as well, which again has been very reassuring on that front in terms of young people and COVID. But those are the questions that we were getting asked, 10, 20 times a day in March and April last year. And without doing that kind of research, you can't really find out those answers. There's lots of smaller bits and pieces of research that's also been happening in quality improvement projects, as well as I talked before, registries. So we have a registry for patients on etanercept, a registry for patients on other biologics. Those are both run out of Manchester. We have a registry for patients with juvenile dermatomyositis, for paediatric vasculitis, and we've had studies into uveitis and various quality of life projects and education projects as well. I'm not going to just reel out a big list of each different research project that we've had, because that would be kind of boring, and I know it's quite hard to keep attention on a Zoom call like this. But if there's any particular area of research people want to ask about, then I'm really happy to kind of go into anything in more detail. But there's lots of research projects going on in Scotland. Sometimes we have to say that we can't do it because we don't have the time. So at the same time as doing lots of projects, we've had to turn down a lot of interesting projects recently, as we've been short staffed since Joyce Davidson left and we hadn't replaced her. But I'm really pleased to be able to say that we've recruited another paediatric rheumatology consultant, so we will be much less pressed in terms of time, and I'm very much hoping that will allow us to get involved in more drug trials and more research projects to offer those opportunities to young people throughout Scotland, and maybe some of the trials that we were getting involved in as well, which we would only be able to run out of Glasgow. And perhaps now that we have an extra person who will largely be working in Edinburgh, that might also be possible to run the same trials in both centres as well, and maybe even Aberdeen as well going forward. So we're really pleased that we have recruited another person, and that I think will take away some of the barriers to research that we've had over the last couple of years. In terms of what's going on in the UK, there's a really useful, regularly updated leaflet run out of Liverpool University. And Liverpool University hosts something called the Clinical Studies Group in Paediatric Rheumatology, which I'm involved with. But there are representatives from paediatric rheumatologists, from pharmacists, from patients and parents, from physiotherapists, from lots of different people around the UK to try and support research in paediatric rheumatology and drive forward research, as well as set strategy for what we think is the most important things for us to cooperate together to learn about in paediatric rheumatology. So they have a really useful leaflet. I'm going to try and move out of PowerPoint and see if I can share this leaflet with you. but I'm not very used to Zoom. I'm more used to Teams, so hopefully it will work. Here it is. Give me a thumbs up if you can see this, if the screen actually changed and you can see this. Excellent, that's good. So I'll scroll through this leaflet, but you can look at it yourself at your leisure another time. But basically, the point I'd like to make, and perhaps not enough people are aware of this, is that if for some reason a research project that would be really applicable to a particular young person is not available in your centre, and it's anywhere within the UK, you're completely entitled to take part in that research project. It might be a little bit more difficult because of geographical travel and things like that, but you are entitled to take part in that project in a different centre in the UK. So for example, particularly at the moment, there are a lot of new trials of treatments in a family called JAK inhibitors, which are taken as tablets for young people who would like to take part in one of those research projects. If they meet the entry criteria and it's appropriate for them, which you should discuss with your own doctor or nurses or team, then and you know are willing to travel, then even if your particular centre doesn't take part in that or hasn't been able to take part in that study, you still can. So one thing that's quite useful is to be aware of all these things. Now, a lot of these studies that are registered in the UK, we are doing throughout Scotland. So the first two are the registries, etanercept and other biologics that I talked about. And CHARMS is a large study that lots of children from Scotland have taken part in, as has Cluster, and those are all really useful studies that have been taken part in JIA. We're not recruiting for them at the moment. They've been very useful studies. Then these, as I move forward, so the ADJUST is a study taking part run out of Bristol in terms of stopping medicines and how to best stop medicines in uveitis. And that's run out of Bristol. The next is a study run out of London about a novel drug used particularly for macrophage activation syndrome. Moving on to the ones which are perhaps a little bit more common. These are baricitinib is one of these oral medicines that can be taken as a tablet. And so there are trials both in polyarticular JIA and systemic JIA, as well as in uveitis, run out of different centres in the UK. And actually in Glasgow, we're moving forward to set up to do a trial in one of these oral medicines, JAK inhibitor for children with systemic JIAs. So this leaflet is always kept up to date and is available from the website in Liverpool that I put up in the PowerPoint, and anyone can go back to the recorded presentation and see that in the future. The nursing teams around the country should also have access to this leaflet, and certainly we're making that available in our clinics in Glasgow as well. And I'll just go back to where I was. So I don't really want to just sit here on a screen and talk for too long, because I know that gets a bit dull and boring. But I can go into any of these aspects or anything else that you guys would like to in more detail. So what I'd like to do now is just open things up for discussion and open to any questions whatsoever about research in paediatric rheumatology.